The US and Europe, the world's epicenters for the coronavirus, are hitting severe bottlenecks as they try to roll out tens of millions of vaccines. When news broke late last year that companies like Pfizer and Moderna had produced vaccines with high efficacy rates, countries raced to get their hands on them. That high demand and low supply led to major shortages and delivery delays in Europe and North America. As all this was happening, vaccines developed by countries like Russia and China were largely dismissed as inferior by Western media and the public. But now evidence is slowly emerging that vaccines developed outside the US and Europe do actually work and can play a crucial role in filling shortages. Countries across the Middle East, South America, and Asia have approved the use of both the Russian and Chinese vaccines along with their Western counterparts. And they haven't seen the logistical jams hampering vaccine rollouts in the US and Europe. So, is there a political bias towards certain vaccines? Is it warranted, or should science and data always rule the day? And to answer that, joining me now from Ankara is Serhat Unal. He is a member of the Coronavirus Scientific Advisory Board set up by the Health Ministry of Turkey. He is also the head of the Infectious Diseases Department at Hacettepe University. And from London, Oksana Pyzik. She is a lecturer at the UCL School of Pharmacy. Oksana, Serhat, welcome to Straight Talk. It's good to have you both on the program. Serhat, could you talk to us about Turkey's vaccination drive and how have the results been so far?
Well, actually, it is so good so far. As you know, we have started the vaccination program in the middle of January, 14th of January, with the healthcare personnel. And immediately following that, we have started to vaccinate the elderly people, starting with 90 years of age, and then coming down to 80, 70. And tomorrow we are starting with the people over 65. And so far, there are more than 3.5 million people has already been vaccinated, and about 350,000 of them are the second doses. We have the Chinese vaccine, what we call Sinovac, that we are very familiar, actually. As you know, we have done the phase 3 study of that vaccine in Turkey.
Yes.
And we have just finished that study, enrolled more than 10,000 people, about 10,500 people. And we are working on the efficacy and the side effects, all that, packing it up, and we will publish it very soon.
So how has Turkey managed to vaccinate its citizens that rapidly, Serhat?
Well, in the first half, the healthcare personnel, we all were in the hospital, so it was the easy part. Each hospital, including the state hospitals, university hospitals, or private hospitals, we had organization for vaccination. We have organized, for example, in my hospital, we have organized what we call vaccine rooms, and each room is occupied by a nurse, and a doctor is also taking place over there. And in this second part, when we go into the elderly people, some of them are the people who are living in the houses where the elderly people are taking care. And it was easy. The team has gone there and vaccinated them. And beyond that, again, the second program included all the hospitals and the family physician centers who are experienced with vaccinating. And
yes.
We have a special program, computer program. When you go in there, it says you whether you are eligible for vaccination or not. And if you are eligible, it says, do you prefer the family physician or a hospital? Whatever you prefer, it gives you an appointment. And if you go to the destination at the exact time, you get your vaccination.
All right.
It was easy and smoothly run.
All right. So, Oksana, for months, we know that some European countries were skeptical of the Chinese and Russian vaccines. Why is that? And is the mistrust rooted in the political bias against those countries' governments, or is it based on hard facts?
Well, certainly we see that some European countries are actually using a variety of vaccines. And actually, Serbia is a good example in which they have sourced not only Pfizer and AstraZeneca, but other vaccines from Russia and China as well. But on the if we're looking at it from a broad perspective, we still are awaiting further, let's say, authorization from the World Health Organization through something called pre-qualification.
Hmm.
So all of that review process from the WHO has not yet been completed, and that starts right from the very basics of even assessing the uh, quality of the manufacturing facilities, everything. It takes a long process if you're beginning from ground zero, let's say. So
Hmm.
that process is lengthy. I think there's a second part here as well, which is around the West is already, or if you think about Europe and UK, US, they already have their own vaccine hesitancy, anti-vaxxer issues, even with vaccines that are being developed within this region.
Hmm.
So when you're also compounding onto that additional factors, I think the governments, despite the fact that recent publications around these vaccines show efficacy, show that they are effective vaccines. So the science is there to support that they do work, but it's also one that needs to be supported by the population, and to some extent, even just any vaccine at this stage has become a very polarized issue politically, with those for and against, no matter where it's from. So I think that governments have a tremendous challenge in not only dealing with the supply issue, the shortages
Yes.
internationally, but even the perception of a homegrown vaccine versus those in, let's say, more authoritarian governments.
Yeah. So, Serhat, what do you think the Turkish government and people were open to receiving vaccines from multiple countries?
Well, Turkey has preferred Chinese so far, but they are in the market to obtain the other ones.
Hmm.
The Pfizer vaccine will be available soon in the country. And as you know, Turkish government has done an agreement with the Sputnik 5 vaccine to produce in Turkey. The process is still going on. And they have negotiations with the AstraZeneca vaccine as well. At this stage, whatever you can reach that is authorized, it has
Hmm.
been proven that it is safe and effective. We can use any of them. And the Chinese was the first one that was available in Turkey, so we have started with that. But beyond that, the phase 3 study that has been run in the country, it's a kind of, I would say, guarantee. I mean, it made this vaccine more trustable. On the other hand, we have been included in the Pfizer vaccine as well for phase 3. So we are ready for that too. But it's
Okay.
depending on the how many vaccines, how much vaccines you can obtain from which company.
Yeah, so now that Europe and US are facing critical shortages, Oksana, some countries like Germany and France are debating whether to start using Chinese or Russian vaccines. Did their initial prejudice cost them time and maybe loss of lives?
Well, certainly, I think that delay in procurement of vaccines has been, in some sense, political. Uh, Even we saw tensions between the UK and the rest of Europe in the distribution of the
Hmm.
AstraZeneca vaccine, and Article 16 of Brexit, which the EU tried to push forward, and then later you turned on, which ended up being a big diplomatic crisis. So I think the really bottom line message is that if you should be, if you have the ability to get a vaccine, then you should take it. If your country has authorized that and has done
Yes.
the review process, then that vaccine absolutely should be uptaken. And I think that as time will go on and acceptance of international vaccines will increase, and following the Serbian model, it'll be more and more common for European nations to also follow that example and broaden their vaccine portfolio. I just think that it does unfortunately take some time, and
Yes.
unfortunately, as you say, that time does translate into lost life.
Yeah, unfortunately. Sarah, the protocols for trials vary even for the same vaccine, and no vaccines are perfect. But it seems Turkey's trials show different results than Brazil and Indonesia. Can you explain why there was such a gap?
Well, actually, let's start with Indonesia. It was a small group, actually. The total number was 1,600, and it's not a large enough group for phase 3 study. So the results is the group is small. You cannot reach the appropriate numbers, perhaps. They have published that as 65%. And in Brazil, it was a large group, and they presented their results in a different way.
Hmm.
As I could understand, they claimed that The vaccine protects against the serious infection 100%, moderate infection 100%, and the mild infection 87%. The number that they're dealing with, a little bit more than 50%, is the number that prevents people even becoming PCR positive. So when you put them all together, they're not very different actually, including the Turkish one. Overall, we have proved that it was 91% effective. So it depends on which way you are looking at and how large is your group is.
So, Oksana, now that the richer nations snap up much of the supply of COVID-19 vaccines, what about the poor countries or developing countries? Has COVAX, for example, started sending doses for those in need?
Certainly, we see that there has been a large, significant delay in delivery for the low-income countries and the lowest income in particular. So even with the political promises made and donations, that's yet when we look at the actual vaccines delivered, that administration rate remains unacceptably low. And if we even go back just to the beginning of January, while high-income countries in total had vaccinated over 39 million people, low-income countries in total had 25. Now that number is higher today, but that was the beginning of 2021, what we had seen. And again, this is a global pandemic, so that type of inequality in distribution of vaccines will have real consequences. We see that LMICs contribute to 75% of the global markets, and that there is an economic case to ensure that we are able to not leave countries behind when distributing these vaccines. And I do think that China does have the ambition to global health diplomacy ambition to vaccinate the world.
It seems so.
And has been, I think, again, with that reporting on the particular trials, I think the main point already highlighted by our colleague on the program is that to prevent severe infection is the most important thing, because that prevents death and that prevents also burdens on healthcare systems.
All right, Oksana, Serhat, unfortunately, we'll have to leave it here. Thank you very much for joining us on Straight Talk.